wall that is made of cells, and they are surrounded by capillaries, like vasorectal or glomerular aspect. So here is the lumen, and then that's just a piece of that wall. So I have cells here, and then you have your blood. So that's a piece of that capillary, right? So, and then that's the lumen, and that's your cell. So how is it possible for renal system to manage hydrogen ion? Let's take a look. Okay? There are three possibilities, mainly, to manage hydrogen ion. And that means, I'm going to bring this over here. So far, so good. Now, I have to deal with this, and I have to deal with that. Bicarbonate versus hydrogen ion, right? So I can bring it here into the lumen of that tubular structure. So I have one possibility here. I have another possibility here. So I'm going to manage hydrogen, right? And then we'll deal with bicarbonate and a little bit of how this actually works. Okay? So if I add this to ammonia, exactly, you get ammonium, right? So this is part of the lumen, so destination urine. That's where it's going. This is the inside the tube. That's going to go to collecting duct and then out of here. So that would be later because we get to deal with urinalysis. So that would be another workshop to go over renal labs and what's going on with the patient and all of that. That's for later. Right now the focus is how to manage hydrogen ion, because that's how you get to determine acidity, right? So I need to manage this. So with this, I get to do this. So that becomes part of what you find in urine. That smell. I'm just saying, you know. So the other one is, another possibility for it is actually to kind of work with this on this side. So that's another possibility for it. Okay? What do I get out of that? Carbonic acid, right? And then phosphate. Plus that?
Is that why you...
Phosphoric acid.
Sorry.
Yes?
Is that why... what would it look like in the urine? I know you said urinalysis later, but the H2CO3, the carbonic acid.
The more concentration, that would change, because when we're looking at urine, we're looking at whether or not we have crystals. So is it clear or not? The color, is it darkened or not? So all of that, later we'll discuss it. So this will give me another possibility. Let me put urine here. Sorry about that. I'm running out of room here. So this will also give me a way to phosphoric acid. So that's why in general normal urine is acidic. So you're looking at pH of 6, right? That's when you change your diet, it changes, but normally, because you're dealing with a lot of acids and stuff to change the pH of urine when it leaves the body, right? So that's how you get to manage hydrogen. Yeah. Just like that. So the way you do this exchange has to do with specialized protein channels that they use ATP to exchange, because you have symport, antiport, and all that, so go to opposite directions. So for instance, you can exchange hydrogen with potassium as an exchange. Remember that you have greater concentration of potassium intracellularly, and then greater concentration of sodium